It is indeed a feel-good breakfast show, Expresso and S3, and September is National Oral Health Month. Time to pay extra attention to your dental routine, and smiling not only offers a mood boost for you and everybody else around you, but helps our bodies release cortisol and endorphins that provide numerous health benefits. And today, we're chatting to somebody fantastic. I'm feeling the endorphins going now already. Okay, let's give her a big smile. Dr. Kgomotso Sepeng to get all of the ins and outs on keeping our smiles in tip-top shape. It's very difficult to talk and smile at the same time, but we're trying, Doctor. Welcome.
Thank you very much for having me, guys.
You make us smile and you help improve people's smiles. So I would imagine this is a vitally important month for you. Maybe a good place to jump off would be what the purpose of Oral Health Month is. What's the drive here?
Okay, Oral Health Month is just to bring more awareness to our communities about taking care of their teeth, their gums, everything in their mouth. The mouth is part of the body, and if you neglect the mouth, you can suffer from dental diseases like your gingivitis and caries. So it's very, very important that we should all be taking care of our mouth and visiting our dentist regularly for a cleaning or any other product that you may be experiencing. So just to tell the people that don't wait for the pay, just come to us and then we can just assist you in whatever form.
So,
Make
Doctor,
it a priority, yeah.
It's very, very important. I mean, I look at South Africa, Doctor. I mean, why do you believe raising awareness around Oral Health Month is so important beyond the obvious?
Say that again?
Why do you think raising awareness is so important, especially with regard to oral health in South Africa?
You know what? It's important in our country, especially from the young age, so that we teach our people that the teeth are part of our body, and neglect thereof leads to many other diseases. Some gum diseases can actually aggravate things like heart diseases. So it's important that we should not see our teeth as something that when there's trouble, we just take it out. It's part of us for function, for everyday activities, for talking, for eating. So that's the importance thereof.
And smiling. We've got to smile more,
Yes.
for goodness sake. We need it. Well, we have the platform right now, so I'm going to ask you what a good oral hygiene routine consists of. What should we be doing?
Okay, the first thing about good oral hygiene is obviously our diet. What we eat is so critical. If you take too much sugary things, it's not good for us. We should be eating right and teaching our kids to eat right. And then the second thing I would say is brushing our teeth at least twice a day, at least for 2 minutes, and with that kind of a stroke, circular motion, so you don't hurt our gums. Because if you overbrush, then you're going to hurt our gums, and it's going to be very painful. And then the other thing that we should do is we need to include flossing into our regime. We recommend that at least when you sleep at night, you should floss your teeth so that whatever you are ingesting throughout the day, you take it out between your teeth. The floss is the only thing that can clean in between the teeth. The toothbrush cannot do those surfaces. And then the other thing that we should not forget is also to clean our tongue. You can use a toothbrush. This is not very recommended, but if you can afford to get if you do have a tongue scraper, that is preferable. So that's what good oral hygiene regimen is.
Thank you so much, Doctor. I think it's quite important that Doctor mentioned flossing, because social media has turned that into a dance move.
What do you mean, like flossing? Like
you see what I'm talking about? Yeah, it actually should be the oral hygiene part of it. I'm glad you touched on that, Doctor. Thank goodness. But let's just talk very quickly about your toothbrush itself. I think that often toothbrushes, they'll sit in the bathroom, and you never know when they actually have passed their sell-by date or when they are not effective for your oral hygiene. So how do you know when to change the toothbrush? It goes from being like
a wire terrier to a poodle.
And then suddenly it kind of flares out, a lot like my hair. And then you realize, hello, we need to change the toothbrush. So, Doctor, can you give us some idea as to how often we should be changing our toothbrush? And how do we choose the right toothbrush? Because I'm sure everybody's gums and teeth are very, very different. Okay.
We should change our toothbrush every 3 months. Normally, I love my children patients, so I will tell them when the school opens, Mommy or Daddy must get you a new toothbrush. So every 3 months, that's when we should change our brush. And then obviously when you see the bristles starting to splay, you know that it is done, and it's not going to do any good, but it's going to do harm. In terms of a toothbrush that is better, soft is always better. People used to believe in the very hard brushes, and that causes you to overbrush, and then when you overbrush, you actually remove the the enamel part of your tooth, and then you end up with sensitivity. So it's important that you brush in a circular motion. You don't apply too much pressure. You're not washing your techies, you just brushing your teeth. And then, yeah, so you must wash in a circular motion. And then in terms of the choice of a toothbrush, I always say the simpler the better. You must get a brush that is of the like the bristles are evenly, what is that, the height is even. Those ones that got orange inside and, you know, the rubbery stump, I don't recommend them because you need to brush properly, like in a circular motion. So we know that people, they're not that attentive to how they brush. So if you know that you're not brushing in a proper circular motion, holding your brush at a 45-degree angle to the gums, then you find that the rubbery things will actually hurt your gums more. So just get a soft toothbrush that's got even height of bristles.
Okay, I love that. Wax on, wax off, circular motion.
Always circular.
And then turn to the side quickly, Betty. When it starts to look like that, replace it.
Replace
every 3 months.
Immediately.
That's what you've got to do.
It's important. But thank you so much, Doctor.
Doc, please stick around. We're going to continue celebrating oral health, being Oral Health Month. But William Arthur Ward once said, and he hit the nail on the head here, a warm smile is the universal language of kindness. Stay with us as we chat and more with Dr. Kgomotso about all things oral health.
It's my feel-good breakfast show.
Welcome back. You are still live with Expresso as we delve into our health topic for today, which centers on September being National Oral Health Month. And it is, I think, an opportunity to pay extra attention to our dental routine. We all have to do it, and we have been chatting with Dr. Kgomotso Sepeng to get all of the ins and outs and how we're going to keep our smiles there and beautiful, because we know that they are vital, because it releases endorphins. It keeps us happy. We need our teeth. It's part of our system.
You know, I actually saw a little meme the other day of there was a gentleman and his eyebrow was missing and he had a missing tooth. And the thing you notice is the missing tooth. It shows you that is the center of your face. It's something so important. And I think maybe that's a nice little anecdote for you, doctor, to know how important oral health is. So we ended our previous segment chatting about flossing, brushing your teeth, when to know when to replace your toothbrush. Let's chat about oral health when it comes to our kids. So what is the right age to start teaching our kids about oral hygiene, brushing teeth, etc.?
Okay, you know, from when they are babies, as soon as the teeth appear, the mother or the father should start, you know, cleaning the teeth. Whether you can use, even you can use a simple gauze, just wrap it around your finger and just clean the baby's tooth and massage their gums. As they get older, you can buy them the kiddies brush and start introducing brushing to them, which is brush, and then they will brush with you. What is very critical is the size of the toothpaste. You must not give too much toothpaste because they can end up swallowing the toothpaste. So it's very important that you should, you know, be introducing brushing, cleaning up the teeth, the children's teeth as soon as possible. When they've got teeth, they should be already brushing.
That being said, when do we introduce, we know that flossing is obviously vital for an adult and we need to be doing it every night to clean those spaces in between our teeth that a toothbrush doesn't reach. When should we start flossing our children, and how would that look?
How does that work?
How does it even work?
Yeah, what are you putting in my mouth, Daddy? Yeah. What's going on?
What's the correct age to start teaching them to floss?
It's the same with brushing. As soon as the two teeth in contact, you need to floss because that's the only way that you will clean by flossing. So obviously you need to do it as gently as possible. Obviously flosses are all not the same. There's others that are very, like they will cut your gums, they're too thin. So you must get a decent floss that will not cut your gums. And obviously you need to know how to floss. It must be gentle, you must not be cutting your gums. So I think as soon as there's two teeth in contact, you should be flossing. So it's just introducing it by step, gently, not forcing anything on them. But it's also important that they should also be flossing.
So, Doctor, over the past year and a bit, almost 2 years, in fact, we've been dealing with coronavirus. Have you found that people have become more and more apprehensive to visit the dentist because of it? And in your practice, have you seen any other health issues pop onto your seat with regard to how the coronavirus has affected everybody?
Yeah, it's been a tough almost over 18 months now. You know, we are health professionals, so we had to be working. People were in pain, people are stressed during the pandemic. And what I've picked up for me in my practice is that a lot of people are clenching their teeth, they are stressing, so they tend to grind their teeth at night, some even during the day. So you see this as wearing off of the biting surfaces of the teeth, where you literally grind off your enamel, and then this gives you sensitivity. It gives you headaches as well. So, you know, when patients present like this to the practice, we actually taking pressures, and then the lab will do a bite bait for us, which they wear at night. Or if you're driving for a long distance, you can also put it on when you're maybe driving alone in your car for a long distance. So we find that people are clenching a lot. You know, even the diet, I think people, as much as they're grinding, but it seems that also, you know, we are eating the wrong things just maybe for comfort. So we find that it seems like too many sweets were had during this time.
We be stressed. We are stressed.
Yeah.
They say a genuine smile comes from the heart, yes, but a healthy smile needs good dental care. That's a famous quote from me right now.
I could tell.
Right this second.
Well done.
We're going to take an opportunity to unpack more around dental health, but Dr. Kgomotso in a moment. Stick around.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. This is Expresso. You're live on S3, and I hope you're smiling because September is National Oral Health Month. Time to pay extra attention to your dental routine, and we've been chatting about so many different things with Dr. Kgomotso Sepeng to get all the ins and outs on keeping our smiles in tip-top shape. So, Doctor, welcome back. We are going to wrap up this conversation. We've covered so many great areas, including toothbrushes, flossing in kids, adults flossing, as well as making sure that we are sticking to a routine that is proper and will be regular as well. So let's just go into a different sector of this, and that is around, let's just say, not only the aesthetic benefits of a beautiful smile, but also, doctor, what are some of the health issues associated with gum disease? And this is, of course, when you don't brush regularly.
Okay, gum disease is, you know, we've got cavities and we've got gum disease. So gum disease is actually affecting the soft tissue of your oral cavities. We see it as bleeding gums. We see it as red, inflamed gums. We see it as puffy gums. Sometimes they have pus. You know, we see it as your gums receding, like the level of the gums is actually going to drop. This leads, you know, to obviously pain, discomfort, things like bad breath. Obviously, when there's bleeding gums, there's bad breath, there's going to be pain associated with it. It can result in you losing your teeth. You know, the bone around the teeth will actually start resorbing, and then your teeth will literally just be mobile, and they will, you know, you have to extract them. And with gum disease, we've seen that people who've got severe gum disease, they are at a higher risk to things like heart diseases. So it also can affect the rest of your body.
It's all interlinked, and I'm so glad that you pointed out that this is a system that all operates in unison, your whole body, including your oral health in that system. What would some of the warning signs be that a person has developed gum disease, and when is the right time to seek assistance, presumably from a dentist?
Okay. I think the most common thing of gum disease is bleeding. Most people, when they start developing gum disease, they will experience bleeding maybe when, for instance, they are brushing or they are flossing. Sometimes it's just spontaneous bleeding. So bleeding is the first sign that there is a problem. Other people can experience some sensitivity around the teeth because now the gums have gone down, and where they were is actually the part of the teeth that are actually very sensitive. So most people will present with bleeding, and you can also experience some bad breath. So obviously maybe your family members or your friends will tell you that there seems to be a problem in there. So those are normally one of the first signs. So we tell people that let's not wait for it to happen. So if you come every 6 months, you should be able to, you know, clean your teeth and keep them in a clean state. But if that does not happen, as soon as you start experiencing some bleeding, rather seek professional help.
Okay.
Doctor, just one last thing. How often should we visit our health professional when it comes to oral health. I think it's an important thing to know because some of us have left it off the calendar given the fact that it's been COVID. And how often should we be visiting professionals like yourself?
Okay, we recommend visiting the dentist at least twice a year. So you should come to us every 6 months. Yeah, that's the recommendation.
Bottom line. Thank you so much, Doctor. Luckily, we're standing 1.5 meters apart all the time, so I can't smell his breath, but he's got a beautiful smile, as do you. Dr. Kgomotso Sepeng, you're an absolute superstar. Thank you for spending the morning with us and educating us, raising a little bit of awareness around the vital role our oral health plays in our overall well-being. Enjoy the rest of Oral Health Month while it's around, and hopefully you guys at home have also gleaned some beautiful little tips there as well.